Somali Rochester Media.
My name is Umar Noor. I am Director of Somali American Social Service Association, Rochester. I would like to thank you today, our leaders, State Senate Erin and Representative Bolden and Representative Fraser. So, as Somali community today, we are very happy to see our leaders to come here to listen our concern. Because in this difficult time, if you come here today, it gives us as moral support as business leaders, business owners, community leaders, and others. Thank you. Now, I welcome to the...
My name is Liz Bolden. I am a state rep here from Rochester, and thank you for joining this morning, and thank you to all of you for being here as well. We are here to talk about sort of the urgency of the Frontline Workers Pay Bill, which we need to get done. And in a time where we are coming up on 2 years in a pandemic, it is time to support the workers who have gotten us through this pandemic. And so with a large surplus at the state level, it is time to support workers. And so we're going to hear more about that. Thank you for coming this morning and for listening. And with that, I will pass it off to Haji Mohammed.
A good day, and very happy to see at least we come together in recognition of the essential workers, how important it is to our economy, to our families, and to enlarge our city and our state. And at the same time, we also have to recognize that it is important to see how we can recognize them. And for this day, I am happy to see at least all our leaders are backing our initiative and our need, our concerns, and so you're welcome. Of course, the challenges of the last 2 years of the COVID-19, which has affected worldwide and especially in our country, and also to all the families. So it also affected our families, and especially the essential workers and the daycare system, of course, as the government has required them to open so that they can help those people who can go back to work. And so it is time now to recognize them so that at least they have their share of the national cake so that they can be appreciated. Because without the backing of the child care systems, the workers will not go back to work. And it is in this day that we can come together, all of us, so that we can appreciate the service they're given, so that recognition can be given. And we hope the leaders are hearing us, and of course everybody out there who's hearing, we need them to be recognized in a daily basis. And of course, at this time when things are very tight, at least they get a recognition of whatever is available in the resources that are available, the state can give them. We'll appreciate it. Thank you very much.
Hello, my name is Helen White, and I'm the director at Quality Kids Care Center here in Rochester. So thank you for having me. I feel so honored and humbled for all the support and to be recognized for our efforts. Childcare was essential throughout the pandemic and is essential every day. Without childcare, parents cannot go to work, leaving companies short-staffed. Childcare workers and providers came to work every day at their own risk because the state required them to show up and stay open for other essential workers. Some even increased staff to assist school-age children with distance learning, which we did ourselves as well. Childcare workers showed up without any PPE, limited access to bleach, cleaning supplies, and more. And without any extra resources, I wouldn't say any, without enough extra resources and pay from the state. I mean, we did receive some grants and help, but it was like a drop in the bucket compared to what we actually need. Yeah. We incurred huge unexpected expenses. We and most other child care centers have operated at a loss since the pandemic started. And so that's 3 years now. Childcare has been in crisis for a long time before the pandemic, but now things are even worse with this added challenge. It is nearly impossible to find enough quality staff to stay open due to the low pay and lack of benefits. And this is because childcare owners cannot afford to pay their workers what they truly deserve for all the education, ongoing training, and hard work that the job requires. Our staff deserve a lot more for their tireless daily dedication and have their own families to provide for. On top of that, we serve some of the most disadvantaged families in the community, opening our doors for those who truly have no other way to go to work except that we help them. And we even offer free transportation to those without a car, but we eat that cost. Nobody helps us. The effects of COVID are ongoing in child care centers, have not stopped, and are actually worse than ever. With the high number of cases in ages 0 to 5 and their inability to keep from closing classrooms at the risk of the whole business shutting down, the cost for child care providers is skyrocketing. The ability to remain open at all is constantly at risk. However, if our center and others like us shut down, the whole community will be negatively impacted. We already have a crisis of trying to find childcare. We are so thankful to Senator Erin Murphy and other key legislators, such as Liz Bolden, for leading on this effort to make sure that frontline workers, including the childcare industry, are getting some recognition in the form of a one-time payment. This is severely needed for childcare workers who live paycheck to paycheck, including me, because they already earn so little. We are also thankful to Governor Tim Walz for his bold leadership on including these necessary frontline workers in his proposed budget. Though this is by far not a long-term fix, it is a step forward in the right direction, recognizing the value, hard work, and dedication of our teachers and providers. Thank you for your time.
My name is Dan Coleman, and I'm a teacher in the Rochester Public Schools. Currently, I'm on leave, and I serve as the president of the Rochester Education Association. I'd like to thank everybody today for the invitation to come and speak, the legislators for backing of this proposed idea, this bill. When we started 2 years ago, education is now anything but normal during this whole time that we've had COVID. Yet day in and day out, just like the early childhood and pre-K settings, we're there. Teachers are there every day. Custodians are there every day. Our paras and our ESPs and our bus drivers and SNS, they're there every single day to serve our students. In Rochester, our paraprofessionals and the support staff have been there since the beginning. If they weren't in a classroom, which of course we went to remote right away, they served in our daycare setting, our SAC setting, so that our students had a place to go. Much like what was just discussed, we know how our economy shuts down when education isn't happening. And so we've tried as a district to make sure there was some way that students could be looked after. Our ESPs helped our teachers get things ready when we went into remote learning. They helped deliver technology, and they helped deliver food to our families and students in need. Teachers changed their entire forms of teaching when we went to remote right away in the beginning of all this. And if you were a student needed to be there physically at school, we figured out a way to get somebody there so you could. In the following years since, our teachers, ESPs, and everybody in Rochester and across the state have worked in person in some form or another with our staff and students. We've moved through different modes of education, whether it was hybrid or distance learning or back in person but split apart. And it's been quite a success story in a sense that we've been able to keep everything up and running. So the entire time we were doing that, though, one of the main concerns was student and staff safety. And with the not always across the state did everyone have proper PPE or were able to do all the mitigation strategies that we were supposed to implement, like social distancing and so forth. And yet, we'll continue to keep everybody going and try to make it work so our staff and students were safe as possible. As we continue through this, third year of the pandemic, I'm here to ask that all frontline workers be given additional pay honors to work as they have done to keep our state going. As I said earlier, we know when educators and the frontline workers aren't working, it causes a chaos with the businesses in the state. Across our city of Rochester, we saw restaurants having trouble getting workers in, and that's because families had to figure out if kids are at home, what do we do? So we've tried to keep those doors open. Asking that these honors also include our educators. To do this, we need the legislature to ensure $1 billion is available to provide it for all frontline workers, that they have the opportunity to have their dedication and commitment for what they've done recognized by our legislature. Educators across the state have stepped up when it would have been easy to step out of the way. We knew the risks. We still know what the risks are. They haven't gone away. And yet, we're going to be there every single day for our families and for our students, and hope that we can continue on through this pandemic.
My name is Marco Loera, and I'm a community organizer with Unidos Minnesota. I'm here representing a frontline worker. My name is Tamara Jokic, and I'm a frontline worker. I've worked through the entire pandemic in the hospitality industry, specifically in hotels. I've seen firsthand how COVID has affected frontline workers. Because of COVID, I am unable to be here today as I tested positive this past week, which means that I am losing about 2 weeks worth of pay. Just like myself, many frontline workers have suffered through the same situation, from housekeepers to front desk agents. Many have been infected and left without any pay, and not just once, but a couple times. But we are considered frontline. We are left directly exposed to the essential. We are considered essential, but we are left directly exposed to the public, which means the probability of contracting COVID are high. We are considered frontline workers, but it feels like frontline only matters in words, but not in action. There are families that are desperately in need because of COVID complications, which is why it's important that the frontline worker payments go out immediately. These payments will help families in need. In Rochester, the hospitality industry has helped keep the town running. Housekeepers expose themselves by cleaning the patient rooms. Breakfast attendants keep those patients fed, and front desk agents check those patients into their rooms. We are constantly exposed, but we show up, because without us, Rochester would not run. It's time frontline workers be treated better and with more dignity.
As I said, my name is Liz Bolden. I am a state rep from here in Rochester. I am also a registered nurse and a mom. And it is really important that we are having this conversation here in Rochester. And I want to thank my colleagues, Senator Murphy and Rep. Frazier, for coming down this morning to have this conversation here, and for all their work pushing this bill through in the legislature. It is essential that we get this done to support the essential workers. In Rochester, we are a medical community. And so as we think about all the nurses and healthcare workers who have been keeping us going through the last almost 2 years at this point, it's important that we support them, along with all of the other frontline workers that have been, kept our community going. That's paramedics and firefighters and grocery store workers and childcare providers and teachers. All of the folks who came to work in a time when, if we think back to, close to 2 years ago, we didn't know then what we know now about COVID. We were not sure how to keep each other safe. Folks were coming to work at their own risk, to their health and to the risk of the health of their families, because they showed up to support our community, to keep things going, to support Minnesotans here in Rochester and across the state. So it is time that we support them as well. We have the opportunity to do that. There are funds to do that. We need to take that step to support them. And so I'm committed to continuing that work to get this done. It is time.
My name is Cedric Frazier, Representative Cedric Frazier from District 45A, which is the cities of New Hope, Crystal, and the eastern part of Plymouth. Thank you all for being here, and I want to thank my colleagues for being here this morning as well. As I was coming down on the drive this morning, I thought about what child care means to me and my family, and I thought about Miss Shirley. Miss Shirley is a child care provider for our youngest daughter, Kalinda, and I thought about how important Miss Shirley is to our family. She almost became like family. And when I think about child care workers, our frontline workers that provide this service, they are essential to our families. They make sure that our moms and dads can get to work and provide the services that we need every single day. And without them, during this pandemic, we would have been in a lot of trouble. But they showed up. They showed up every single day. And like Helen described earlier, they showed up knowing that they were going to be exposed to or potentially exposed to COVID on every single day. And they still do that because the vaccines are lagging. Certain age groups took a little bit longer than they did for adults to get the vaccine. And they continue to show up every single day, knowing that they put themselves at risk and they put their family members at risk. But they did that because that's the job that they chose to do. They did it with a passion, they did it with care, and they did it to take care of all of Minnesota. And without them, we would not be in this situation where we have a $7 billion surplus. We need to take those resources and we need to show appreciation for those workers that showed up every single day. Child care workers especially, because they made it possible for all workers to be in their workplace. But every single frontline worker, we need to make sure that we show them that appreciation. And it is only a small token of what we can do. There's not really a way for us to repay them for the sacrifices that they've made during this terrible time that we've gone through for the last 2 years. So I'm a proud author of the House bill to push this forward, along with Senator Murphy, who's carrying the bill in the Senate. I want to say to my GOP colleagues, now is the time. It is the moment. We have the money. We have the resources. It's a small thing to do. We need to step up for our essential workers and our frontline workers and do what we need to do. We know it's right. Let's get this done and let's show them that appreciation.
My name is Erin Murphy. I am a member of the Minnesota Senate. I'm a mother and I'm also a registered nurse. I'm very, very happy to be here today to once again talk about why it is important that we recognize Minnesotans' frontline workers. The stories that you've heard today are just a sampling of the stories that we've been hearing now for more than a year as we have embarked on finding a way to make sure that we are making whole the people who went to work when many of us went home. One day we will look back and there will be a profound story to tell about how we experienced this together in Minnesota. And the frontline workers are going to be in the center of that. When we didn't understand how the virus worked, when we didn't understand the risks, some people were tapped to go into work. They did that to keep us healthy, to keep us alive, and to keep our economy going. And as a result of that effort, we now are experiencing a $7.7 billion surplus that is earned through the work of Minnesota's workers, and the frontline workers are due their share. Many frontline workers got sick. Many frontline workers lost leave time, they lost pay as they quarantined or as their children quarantined. Many got sick and some died. This is no laughing matter. This is a very, very important issue. And at the end of last session, we all agreed, bipartisan, Democrats, Republicans, House, Senate, and the governor, that we should set money aside and make an agreement to get that money into the hands of the frontline workers. And at the end of that process last fall, it got stopped by the Republican efforts to put roadblock issues like anti-vaccine mandates and firing a commissioner in front of finishing the work for frontline workers. We agreed at the end of last session that this was a priority, and we now must make it a priority at the start of this session. Before we think about tax cuts for large corporations, before we do any other work, we must finish this job. And I'm calling on Senate Majority Leader Jeremy Miller, along with Senator Carla Nelson, Senator Dave Senjum, to join the rest of us to make this happen. It must be a top of the calendar priority for Minnesota for this session so that we can get a generous $1,500 check to every one of the frontline workers. And let me make sure that we're clear about this. In the course of our work last summer and fall, when we were negotiating over who, the Republicans in the working group decided that only some were worthy of a frontline worker check. They excluded child care workers, meat packers, grocery store workers. They excluded a large segment of frontline workers. We do not agree. We are in the position we are in now in Minnesota because of the work of all of the frontline workers. And I'm grateful to be here today with educators, with people who work in hospitality, and of course with child care workers, along with all of the other frontline workers. We stand together in solidarity and believe every frontline worker should get this benefit. Thank you very much.
I also want to ask one quick question, is that the faith-based organizations, basically churches and mosques, who have also been considered who are essential in terms of these hardships, in terms of spirituality, helping families with their funerals as well, and also making sure that families heal through these challenges, basically. Are they considered in this bill as also basically as essential workers as well?
Where you were required to do things in person during the stay-at-home orders, those workers would be covered. So we'll take a look at that as well.
Thank you.
Thank you so much for being here.
Thank you.
Somali Rochester Media subscribe.